Good afternoon, everyone, and a very warm welcome to today's webinar, Something Fishy About Fissure, Myths, Mistakes, and Modern Cure, presented by Onus Robotic Hospitals, Hyderabad. I am delighted to have all of you join us for this informative session that aims to break the stigma, clear common myths, and shed light on the latest painless treatments for anal fissures. We often see patients suffer silently due to embarrassment or misinformation about this condition. But today we have with us an expert who will help us understand fissures better and guide us through modern, effective solutions. It's my pleasure to introduce our speaker, Dr. Raghuteja Padma, a highly skilled laser laparoscopic and general surgeon at Onus Robotic Hospitals, Hyderabad. Dr. Raghuteja specializes in advanced laser treatments and minimally invasive surgical procedures, helping patients recover faster and live pain-free lives. So without further ado, let's begin today's session and learn the truth behind fissures, their causes, myths, and modern cures. Welcome, Dr. Raghuteja Padma. Please take it forward.
So thank you so much, Ajay, for the introduction. So this is the most important and neglected surgical issue in recent times, because most of the software individuals or corporate employees, due to like sedentary lifestyle or due to like inadequate hydration, this is the most suffered, neglected surgical issue in recent times. So fissure, there will be a sharp pain in the anal region, the anal canal. What exactly is fissure? Fissure is, there is a cut, there is a tear in the anal canal region. There will be an anal ring, right? So at that anal ring, there will be a tear in that region. But why does this happen? So there are different reasons. One, due to hard stool. What happens in constipation? There will be formation of hard stool. And due to sedentary lifestyle, this constipation adds on. And second thing is, due to inadequate hydration, the stool becomes very hard in the intestine, mainly large intestine. This hard stool, whenever it passes through the anal canal region, it tears the sensitive area. Because the anal canal is a sensitive part or sensitive area, the skin is so sensitive that that hard stool will cut that sensitive skin or mucosal tissue of that anal canal, which leads to formation of fissure. So fissure is a small tear in the skin lining the anus, causing pain and bleeding. So whenever there is a cut in the skin, there will be severe pain. Compared to subcutaneous tissue or more deep tissues injuries, the skin injury is more pain when compared to these injuries. The reason why anal tear injuries will have severe pain. So this hard stool will cause tear. This tear will lead to severe pain and bleeding from that area. This is the main characteristic feature of fissure. Patient will come to us with these complaints like, sir, I have severe pain while passing the stool. So that itself indicates us that maybe we will ask the next question, that how is your stool, how is your bowel and bladder habits. Then he himself explains us that I have constipation for last like 2 weeks or 3 weeks or 1 week, and I am not having proper hydration. So this is the one lead point to diagnose it as a fissure. So key points, it can be acute or chronic. Acute fissure is if it is less than, if he is suffering, he or she is suffering with the pain or bleeding or with the fissure for last say 1 month or 2 months, short span of period, then you call it as acute. If it is like 6 months, more than 6 months, then we call it as chronic fissure. So often caused by constipation, trauma, or bowel habits. One more important etiology which is trending these days is insertion of foreign bodies into the rectum. So people are trying different foreign bodies. I have seen like one patient, he came to me with insertion of a screwdriver, and it is unbelievable. But the thing is, the patient is a psychiatric patient. He is on antipsychotics and antidepressants. And one more patient, he came to me with a insertion of 6 to 7 centimeters of kira, you call it as cucumber, right? So that they have inserted into the anal canal. So due to like exposure to uh, say pornography or something, we don't know, but recent times these cases are increasing, which is leading to again formation of fissure in these patients. And third thing is people who practice anal sex is also a one more etiology for fissure formations. So these are all the main etiological factors which may lead to fissure, but the most important thing is constipation and inadequate hydration. Then sometimes after surgical, like post-operative patients also have this problem, because during surgery or after surgery, the movement of the bowel will slow down. This slowing movement of the bowel will again lead to constipation, which leads to the fissure formation. So signs and symptoms, as we discussed, there will be a sharp pain during or after passing stool associated with bright red bleeding. So how will be the bleeding? The bleeding will be, there will be streaks of blood on the stool. Whenever the patient passes the stool, there will be streaks like lines of blood, lines of drops of blood on the stool itself. And there will be itching or irritation around the anus. These are the three important characteristic symptoms of fissure. But why it is misunderstood, or why it is neglected is one thing, they'll confuse with piles. They think that maybe I had some outside food or some junk food, because of this I may be having this problem, it will settle down in 2 to 3 days. They will think in that way, but sometimes it may not heal, because what happens in fissure is the sphincter, the internal sphincter or external sphincter, the anal sphincters, they will be like in this tightened position. They'll be adhered to together, that internal and external sphincter, and it will be tightened so much, the sphincter, that the patient can't pass the stool. Because of that, he has to strain. That straining will again result in increasing the size of the fissure. So this happens for last say 2 months, 3 months, or 4 months, 6 months. It continues. This leads to formation of chronic fissure. So then we call it as a chronic fissure. So chronic fissures will not heal. They has to be treated with surgery. How? We have to release the sphincter, that we'll see in the next slides, but this is what happens, the pathophysiology behind the fissure. So people ignore it, which leads to pain, chronic pain. They'll confuse with hemorrhoids, infection, or irritation. They'll think that there is a small irritation at the anal canal, maybe it will subside in 1 day or 2 day, but it will not subside. The days will pass on, but patient will not be relieved out of the pain. So don't let a tiny tear ruin your life silently. So this small tear in the anal canal, it will disturb the work experience. It will have a mental stress to the patient, and patient can't even sit because of this. There will be some sort of discomfort for the patient. So what are the causes mainly, or already we have discussed that constipation, And hard stools, straining while passing stools will again result in increasing the size of the fissure or the tear. Then childbirth or trauma, this we have missed, like during normal labor or childbirth, there will be tears in the anal canal because of that pressure. So poor hydration and diet already we have discussed, and sitting for long hours, sedentary lifestyle, this also we have discussed already. So coming to the complications. So complications, if we ignore, what exactly happens is that acute fissure will turn into a chronic fissure. That chronic fissure may require surgery. Acute fissures may not require surgery because the pain will be severe. We need to give some anti-inflammatory drugs or painkillers, something like that. Then we will give some sits bath. Patient has to sit in the tub with some lukewarm water and betadine solution added to that lukewarm water, which will relax the sphincter. That I will explain in the next slides. But this is what we will do for acute fissures. But if it is a chronic fissure, it has to be operated with surgery. What surgery we'll see in the next slides. And infections, if the fissure complicates, there may be possible chances of entry of bacteria into that tear, which may lead to perianal abscess that we call as infection. And there will be painful bowel habits. Whenever the patient passes the stool, he will be having severe pain, and emotional stress and social discomfort, which I have discussed earlier, that they can't do their work properly. There will be something going on in their mind that they'll not be happy with that fissure. So diagnosis, how doctors detect the fissure is, whenever the patient comes to the surgeon, we will ask the history. So the history of constipation, water intake, any previous history of childbirth or pregnancy, or any previous surgical intervention they have underwent, or any as we have discussed, like any foreign body insertions knowingly or unknowingly. So this will tell us that the patient is suffering from fissure, this history itself. Then patient will ask the symptoms of the patient, like any pain while passing stool or blood on the stool, something like that. This again will fetch us to the diagnosis of fissure. Then sometimes we do anoscopy, but only for chronic fissures, not for acute fissures. Because in acute fissures, if we insert the anoscope, it will cause a severe pain to the patient. So we avoid that. For chronic fissures also, most of the time we'll avoid anoscopy. Only by clinical examination, we can determine that patient is having a fissure or not. So then coming to the treatment, the good news is fissure, it can be treated very well if it is diagnosed earlier. If it is an acute fissure, if it is diagnosed within a 1 week or 2 weeks, we can treat fissure with some medications. So what are the medications and lifestyle habits we will ask the patient to change? Like one is fiber rich diet, which is very important. Fiber softens the stool. This soft stool will again prevent constipation, which prevents the fissure pain in the fissure. So fiber rich diet and hydration are most important things which we advise to the patient. And sits bath. Sits bath is, as we have already discussed, there will be a tub in which there will be some lukewarm water poured with betadine solution added. So we'll ask the patient to sit into that tub with the anal region or anal ring he has to make sure that that anal ring is in it is in contact with the lukewarm water. So what this will do is, like, it will relax the sphincter, the internal sphincter and external sphincter. Whenever there is relaxation of that sphincter, stool will be passed easier and patient will not have pain. And it also helps in healing of that fissure, because that lukewarm water will dilate the blood vessels over there, which leads to improved oxygen supply to the tissues over there. So this oxygen supply will heal the fissure automatically. So then we'll advise some pain relief creams, anti-inflammatory creams, and sphincter relieving creams. Calcium channel blockers we give. What calcium channel blocker creams will do is calcium what it does is it makes the sphincter tight. Whenever we block the calcium channels, so the calcium will not enter there and the sphincter will be relaxed. This again will helps in healing of the fissure. And we'll apply some topical medications, lignocaine jelly, something like that. And recent times we are also injecting Botox injections for better healing of the fissure. So this is what we do in acute fissures. So surgery may not be advised for acute fissures. It can be treated with some lifestyle changes. So most fissures heal in a few weeks if caught early. This is what is most important. So whenever you have such type of pain at the anal canal, severe pain with bleeding, post constipation, then suspect it as a fissure, reach your surgeon as early as possible. You can treat the fissure without surgery. It is not mandatory for a surgeon or any doctor to go for surgery in the initial stages. So prevention, keep it away, healthy diet and hydration, again, avoid straining, timely treatment of constipation, regular exercise. All these are very important to prevent. So catch it before it catches you. A fissure free lifestyle, it is most important. Then key takeaways: fissures are common but often ignored. Early intervention, faster healing. Early intervention helps in faster healing. Prevention is easier than cure. Don't be embarrassed to talk about it to your doctor. Spot the fissure before it spots you. So laser sphincterotomy. When we do laser sphincterotomy, then what is laser sphincterotomy? So we have sphincters at the anal canal region. That sphincters are like they will become very tight in these fissures, mainly chronic fissures. So there is no chance that we can heal that fissures without doing sphincterotomy. So if we cut some 30 to 40 fibers of the sphincter, then the anal ring will be opened. Automatically the fissure, the tear, it will heal because of the good blood supply to the fissure. Due to as we are excising the sphincter with laser, this leads to healing of that fissure. But this will do only in chronic fissures, not in acute fissures. So I will show you a small video uh, of laser sphincterotomy, animated video, so that it will be a bit easier to understand. So so this is for a patient of 65-year-old male. We have done a laser fissurectomy, a sphincterotomy. So what we'll do is this is a Botox injection. Sometimes we'll give for some patients because sometimes the sphincter will be very tight. So we'll give Botox injections before that to make the sphincter relaxed. Then we'll excise the sphincter with laser. So this is how we'll inject This is the anal canal, anal region. Then you can see here between the anal canal and skin region, we will find white fibers of sphincter here. So we'll trace those sphincters and we'll excise only 30 to 40% of fibers of that sphincter. So not entire sphincter we will excise, only to 30 to 40% with lasers. You can see here. So this is the laser we are using. This is a diode. So that sphincter fibers will excise with that laser. That's all. It is just a 5 minutes procedure. Just a 5 minutes procedure, which will help the patient like for years together. Just by cutting the fibers of the sphincter, he will feel so much relaxed that he will not have pain immediately. Within like 3 hours or 4 hours on the same day, night will discharge the patient. From the next day itself, he will feel a lot of difference. So with the laser, there will not be any cut, there will not be any incision. We will just cut the fibers directly will enter through the skin into the sphincter area and will cut the fibers of the sphincter. Then it will relax. The sphincter, whenever the sphincter relaxes, automatically the anal ring will become lax. That lax anal ring will helps in passing the stool easier. So this will help the patient. There will be huge difference in the clinical symptoms for the patient with this laser sphincterotomy. So this is how we will treat the sphincter. This is about the fissure, like acute fissure, chronic fissure, symptoms, clinical features, diagnosis. There is no hi-fi diagnosis. There is no hi-fi imaging needed to diagnose this fissure. There is no like complicated surgery done for this fissure. It is a small 5 to 10 very easy and helpful to the patient. Within one day they will become so happy because they will be relieved from the pain. So what I wanted to share to the viewers or who have attended this webinar hall or who will watch the video in YouTube is, don't suffer with this fissure pain. Like most of the people, they will suffer for themselves. They will neglect that pain, they will neglect the disease, and which may lead to chronic fissure associated with sentinel tags, sentinel piles. Slowly fissure may lead to perianal abscess. Whenever the abscess forms, if the abscess is not addressed properly, it may again lead to fistula formation. So if someone has fistula, it is very difficult to manage. So don't just complicate your disease. If you have any symptoms like pain while defecation, bleeding while passing stools, or itching at the anal area, any swellings at the anal area associated with pain, fever, just reach your surgeon nearby. And as a laser and laparoscopic surgeon, I am always available to you at Onus Robotic hospitals, and I am specialized in doing such surgeries like laser proctology, laser hemorrhoidectomy, laser fistulectomy, laser sphincterotomy, fissurectomy, laser varicose veins excisions. So you can happily anytime you can reach me. There will not be any judgments. Without any judgments, you will be treated, and it will be most confidential with our team, and we have a professional team. Nothing to worry about your disease. So please, as I request everyone in this platform, that don't suffer with pain or fissure. Just meet your surgeon. This is just a 2 to 5 minutes procedure. Please cooperate. You will be free from the pain. Thank you.
Thank you so much, Dr. Raghuteja Padma, for that insightful and eye-opening session on fissures, the myths, mistakes, and modern cures. Now we'll move on to our Q&A session. We've received some interesting questions and our participants from our participants. Let's take a few of them. The first question from you is that many people confuse fissures with piles. Can you explain the difference between the two?
See, this is the most important question, and many of them, like, they will have a lot of confusion with fissure, piles, and fistula. Fissure is there is a tear in the anal canal region, in the skin region. So it is quite superficial, and it is not even subcutaneous, quite superficial, but it will be very much painful. So fissure is painful, associated with bleeding, and the blood will be on the stool. It is like streaks on the stool. So this is about fissure. Coming to piles or hemorrhoids, piles are like blood vessel dilatations. So we have blood vessels in the arms or anywhere in the body, face. Okay. In the same way, we have blood vessels in the anal canal as well, right? So dilatation of these blood vessels, anal canal blood vessels or rectal veins leads to hemorrhoids. Hemorrhoids are not like they are tumors, or not like they are not anything related to cancer or any tumors. They are blood vessels which are dilated. So these dilated blood vessels, they sometimes bleed. So how will be the bleeding in hemorrhoids is, after washing from whenever the patient finishes passing stool, everything, he raises from the commode after washing his anal area, then he will see 1 or 2 drops of blood in the commode. This is the difference between bleeding in fissure and bleeding in hemorrhoids. There will be severe pain in fissure, there will not be pain in hemorrhoids. There are two types of hemorrhoids: internal hemorrhoids and external hemorrhoids. Only if the patient is having external hemorrhoids, or if the hemorrhoid is thrombosed, then those hemorrhoids will be painful. Otherwise, hemorrhoids are not painful at all. So fistula is another different entity. There will be tract formation. There will be two holes, one outside, one inside in the anal canal. They will be connected like a tract. So there will be discharge. The main complaint in fistula is discharge, anal canal discharge, associated with one hole at the anal canal region. So this is the difference between fissure, hemorrhoids, and fistula. One has to know clearly the symptoms and the difference between fissure, fistula, and hemorrhoids.
Thank you for that answer, doctor. Another belief is that fissures happen only to people with poor hygiene. Is that true?
No, fissure is, yes, one thing is important, like maintaining anal hygiene is most important to avoid abscess or fissure, anything like that. But fissure mainly happens because of constipation, because of improper hydration, because of improper diet, like not allowing fiber diet, not taking fiber diet in your meal. So all this leads to fissure formation. The most important thing is constipation. And in recent times, as I have already mentioned, and we are seeing a lot number of cases related to youth mainly, or foreign body insertions in the anal canal or rectum.
Thank you for that answer, doctor. What precautions should patients take after fissure surgery or ensure full recovery?
So fissure surgery is a laser sphincterotomy that we have discussed. So after laser sphincterotomy, patient will not have any scar at the anal canal region. Only thing they have to do, one important thing is they need to avoid constipation. So to avoid constipation, they have to take proper high fiber diet along with some laxatives if necessary. Doctor will prescribe laxatives. Along with that, some lignocaine jelly or something like that. And sitz bath has to be done. Sitz bath is that we have discussed, sitting in the tub with lukewarm water. This will relax the sphincter and will avoid the recurrence. So it has to be done like for one week or 2 weeks. And patient need to avoid constipation, properly hydrated, not to sit for long hours, need to walk like for every 1 hour, they need to walk like 5 to 10 minutes, so that all these habits will prevent recurrence of fissure.
Thank you for that answer, doctor. Actually, that was my next question, though, that you have answered right now. That how do patients avoid recurrence of fissures after treatment? So thank you for that as well. My final question to you would be: when should one decide to see a doctor instead of trying home remedies?
So that is what home remedies. Home remedies will work only for constipation, or see, there are a lot of videos in YouTube to prevent constipation. Like some will say to have warm water, someone will say to have jeera water. So people try different different all remedies from YouTube and all. At the end, what they'll do is they will come to us with complicated disease. So what I wanted to suggest people or patients or who are watching the video is like, just see your doctor. Okay, if you go to a mall, if you buy something, it will be like around 1000 2000 rupees minimum. Okay, like if you want to buy a nail polish, it will be around 500 600 rupees. If you want to buy a bag, like handbag, it will be around 3000 4000 rupees, right? But you hesitate to visit a doctor for just a consultation. It will cost around like 500 600 rupees, but it will save you from a surgery which costs around like 40,000 50,000 or 1 lakh rupees sometimes. Okay, it is not about a cost. The second thing is, it is a mental trauma, it is a mental stress, and it will disturb your work as well. So why suffer in silence? Why to try all remedies? Just meet your proper nearby experienced surgeon, and there are there are a lot number of surgeons available. Just visit your surgeon and solve your problem. Why to start all funny remedies? They may not work sometimes. So mainly for chronic fissures, if they are suffering from last 3 weeks 4 weeks 1 month with the same pain or bleeding, so my request is just please visit your surgeon and solve the problem.
Thank you, Doctor. As we come to the end of today's webinar, I'd like to extend a heartfelt thanks to Dr. Raghuteja Padma for sharing his expertise and help us break the myths around fissures. A big thank you to everyone who joined us today. Your participation and enthusiasm make sessions like these truly meaningful. Before you leave, we kindly request all participants to fill out the post-webinar survey. Your feedback helps us improve and bring you more informative sessions in the future. You can fill the survey after this webinar, which will be popping up on your browser. Alternatively, it will be on your email as well. You can fill it from there. Once again, thank you for being a part of this informative session, Something Fishy About Fissures, Myths, Mistakes, and Modern Cure. Stay healthy, stay aware, stay happy, and we'll see you again in our next webinar hosted by Onus Robotic Hospitals, Hyderabad. Thank you.
Thank you, Ajay.